Welcome to The Aesthetic Doctor. I'm your host, Sarah. Have you ever looked in the mirror and wondered why your face seems to age differently from your friends or siblings? Maybe you're seeing fine lines while they're dealing with sagging, or you're battling dark circles while they're concerned about definition loss. Today, we're diving into a fascinating topic that explains these differences and might just change how you think about aging forever. Have you ever wondered why some people seem to age differently than others? Why some develop wrinkles while others experience more sagging? Well, today, we're going to unlock these mysteries. I'm thrilled to welcome Dr. Rogier Meulenaar, our medical director and aging morphotype expert. Dr. Meulenaar, welcome to the show.
Thank you, Sarah. I'm excited to share this knowledge with our listeners.
Before we dive in, can you explain what exactly we mean by aging morphotypes?
Of course, think of aging morphotypes as your skin's unique way of telling its story. Just like we all have different fingerprints, we also have different ways of aging. Understanding your specific type is crucial for achieving natural looking results in any aesthetic treatment.
That's fascinating. How many different types are there?
We classify aging into four main types: tired, wrinkling, deformative, and muscular. Each type has its own characteristics and requires a different approach for optimal results.
Let's start with the tired morphotype. What are the key characteristics people should look for?
The tired morphotype is actually quite common among our patients. Imagine your face as a painting canvas that's starting to lose its natural tension. The main signs are dark circles under the eyes, a somewhat flattened cheek area, and that persistent tired look even when you're well rested.
That sounds familiar to many of our listeners, I'm sure. Can you share a patient experience?
Of course, I had a patient, let's call her Maria, a 42-year-old professional who came to us frustrated because people kept asking if she was tired or unwell, despite feeling great. The key issue wasn't wrinkles. It was volume loss in specific areas that created shadows and that tired appearance.
And how did you approach her treatment?
This is where our holistic approach really shines. For tired morphotype patients like Maria, we focus on three key areas: restoring volume in strategic points, improving skin quality, and addressing the underlying causes. We typically start with skin boosters to improve hydration and elasticity, then carefully place fillers to restore natural volume, particularly in the tear trough and cheek areas.
Moving on to the wrinkling morphotype, how is this different?
The wrinkling type is fascinating because it's more about skin texture than volume loss. These patients typically have fine lines all over, especially around the eyes and mouth. Think of it like a piece of fine silk that's been creased. The structure is still good, but the surface needs attention.
And what's your approach here?
For these patients, we focus heavily on skin quality treatments. One of our success stories is Sophie, 38, who was concerned about developing the same fine lines she saw in her mother. We created a comprehensive plan combining regular skin boosters, targeted botulinum toxin treatments, and specific skincare protocols. The key is prevention and maintenance.
What about the deformative morphotype? That sounds more serious.
Actually, it's just another natural way of aging. This type is characterized by changes in facial contours. Think of it as the face's architecture gradually shifting. These patients often notice changes in their jawline and cheek areas first.
And the muscular type?
The muscular morphotype is particularly interesting because it's often seen in people with very defined facial features. These patients typically have strong facial muscles that can actually accelerate certain aging signs. We see this often in patients who clench their jaw or have very expressive faces.
Let's address some common questions. First, how can our listeners identify their own morphotype?
While a professional assessment is best, there are some signs to look for. Look at your face in the morning, well rested, and ask yourself,
Do you mainly see tiredness and shadows? Are fine lines your primary concern? Are you noticing changes in your facial shape? Do you have very defined facial muscles? What about timing? When should someone start thinking about these treatments?
prevention is always better than correction. While the ideal time to start varies for each morphotype, I typically recommend beginning basic skin quality treatments in your early 30s. For example, someone with a wrinkling morphotype might benefit from starting earlier, while a tired morphotype might focus more on preventive measures in their mid 30s. But remember, it's never too late to begin. The key is starting gradually and focusing on natural results.
Can you share some daily care recommendations for each type?
Absolutely. For tired morphotypes, focus on eye care and lymphatic drainage massage. For wrinkling types, prioritize sun protection and hydration. For deformative types, include facial exercises and lymphatic drainage. For muscular types, consider stress management to reduce muscle tension.
These are fantastic insights. I notice you emphasize natural results throughout. Why is that so important?
At Practique for Injectables, we believe in enhancing your natural beauty, not changing who you are. Our goal is to help you look like yourself, just refreshed and revitalized. It's about working with your natural aging process, not fighting against it.
And what's the first step for someone interested in learning more?
I'd encourage listeners to book a comprehensive consultation. We take time to analyze your specific morphotype, discuss your concerns, and create a personalized treatment plan. During this consultation, we use advanced imaging technology to show exactly how your face is aging and explain which treatments would work best for your specific type.
This has been incredibly insightful, Dr. Meulenaar. For our listeners who want to learn more about their specific aging type, what would you recommend as a first step?
The best way to start is with a personalized consultation. We offer complementary morphotype analysis where we can determine your specific aging type and create a customized treatment plan that focuses on natural, long-lasting results.
And how can our listeners book this consultation?
They can visit our website at www.praktijkvoorinjectables.nl or call us at 531-8840-123-678. We'll take the time to understand their concerns and goals and create a personalized approach that aligns with their natural aging process.